Good morning, it's Dr. Rodney Mogan, and it is Thanksgiving week. And one of the things that I want to really, first of all, say is thank you to all of you that watch. Thank you to everyone out there. I hope you have a really good holiday and a very great, relaxing, hopefully, and just great recharge and just great time with your family if that's what you're doing. What I want to talk about today, and before I get started, is if you could like and hit subscribe and pass it around to everyone, really would appreciate that. But what I would like to talk about today is something that happened a couple weeks ago, and that is the reopening of the federal government. This should hopefully help a little bit as we get into travel season and different things like that. But I talked about in another video that the main reason for the shutdown was the Democrats were focused on healthcare. More importantly, they were focused on the subsidies that were going away for the Affordable Care Act, or ACA, or otherwise known as Obamacare. And those subsidies were never actually put in place under the original ACA. They were put in under Joe Biden's administration under the Inflation Reduction Act. And I don't know how subsidies for health insurance goes with inflation reduction because it's government spending, so it increases inflation, but that's a whole different story. But so they keep saying they're ACA era subsidies. They're not. They're actually Inflation Reduction Act era subsidies that were part of that bill, and they were meant to be temporary. They extended the subsidies that were put in under COVID, under the COVID rescue plan, again, meant to be temporary. Not only did they extend it, but they also expanded it under the One Big Beautiful Bill Act, OBBA. It actually removed those subsidies at the end of the year. We are now in open enrollment for that, and so people are making some decisions. Right now, they're getting subsidies. In January, they will no longer get a subsidy. And so, do they enroll on that health plan that they probably need for their family, or do they not and risk not having coverage, and then hopefully there's no major issues? We're getting back to where we were prior to the ACA back in 2009, where people were making financial decisions whether or not to have insurance or not have insurance. And that is actually, I think, where the Democrats have really pushed the conversation and put a really big win, is when we are talking about healthcare, they tend to stay in power and they tend to take over power. And when the Republicans were talking about the economy and talking about illegal immigration, those are their points where they stay in power or gain power, as happened in the last major election. But with the government shutdown, I think that I don't think it's really switched, but I think that has actually allowed the Democrats to make healthcare a conversation. And if it can make it a conversation, it might help them in the long run. I am not saying that Democrats won the shutdown, Republicans won the shutdown. I don't think anybody won the shutdown. I think the American people actually lost. But I think that healthcare piece actually did make it into the conversation. Now, with healthcare, what they did was now they have forced the Republicans to either not vote on extending subsidies, even though they said they would, so basically put them on record saying they're not going to vote for subsidies and kill it, or force them to actually come out with a plan. The Republicans have never really truly come out with a health care plan. They had a quasi one under Donald Trump in 2017, but it wasn't really a good one. That's why it failed in the Senate, and it wasn't really robust. However, Democrats have put out a plan, the Affordable Care Act. It's not perfect. It's not. There's a lot of different things we can debate on, but they have a plan. Republicans have never really truly come out with a plan. So now what the Democrats have done is saying, hey, we have a plan. We're just trying to fund our plan. We're just trying to help people with our plan. You're the one that doesn't want people to be on there. Now, Republicans will say that 1.5 billion of those subsidies are actually going to undocumented or illegal aliens. They're covering other different things, that states have expanded those programs way beyond what the scope was. And there is some truth to that, but most people are just looking at whether or not they can pay for their health care bill or not. And that is going to affect also, if they're going to pay for that health care bill, they're going to spend less for Christmas. That's going to, reduce travel. That's going to reduce gifts. It's going to reduce shopping. It's going to potentially do a lot of different things on the economy. So healthcare is a really vital piece of the economy. It's probably why you're wondering, why is Dr. Rodney talking about healthcare when he generally talks about economic principles? Well, because this is an economic principle to think about. And so one of the ways that you have to look at it is we have really, truly a limited supply of healthcare. We are seeing rural hospitals close due to Medicare, Medicaid funding gaps. That's predominantly people who live in rural. That's generally where they're generally getting their medical coverage through Medicare or Medicaid. And they're not reimbursing at the same levels. They're trying to cut different things. They're not covering different bills. They're not covering different prescriptions, things like that. The Trump administration and the Biden administration have actually tried to reword that and rechange that, and they're doing different things to make that a little bit easier. But you're seeing rural hospitals drop. You also, so now you have rural America not getting coverage. You then also have inner city America, which is in an obesity crisis. And, love them, hate them, agree with them, disagree with them. Secretary Kennedy is actually trying to do something about that. Being autistic, I think he's going about the completely wrong way when it comes to autism. I do not think that it comes completely from Tylenol. I do not think that it comes from circumcision. I don't think autism always comes from vaccines. I think you can make a case that maybe some cases might come from that. But, really when you really look at it, when we're talking about autism, it just increases, the rates are increasing because we're actually diagnosing it, we're actually treating it, we're actually looking at it. 30 years ago, 40 years ago, even 20 years ago, people didn't want to get their kids saddled with a diagnosis. People didn't want to be saddled with that image, so on and so forth. So unless it was really, really bad, they didn't get a diagnosis. So yes, we are seeing higher rates. But I think from an economic perspective, I think that's more because people are seeking the diagnosis more rather than their rather than some of these other causes. So now you start looking at that and how that's affecting the economy, the spending, the different things, because you get an autistic diagnosis, you get other diagnoses. You now have additional strain on the healthcare system. Well, healthcare system is only so much. So how do we actually bring down healthcare costs when we know supply is low, but the demand has actually grown? We have semaglutide people trying to obesity, trying to lose weight. We have that. Now that's generally more on the influence side. But we're seeing that increase. But we know that inner city has higher rates of obesity right now. We know they have higher rates of blood pressure, and so they could probably benefit from that. So how do we lower that cost so they can get access and maybe get them off of diabetes drugs and different things like that and get them healthier? Those different things. So, but there's only a limited supply of that. So that means a higher demand means a higher price. So with that, how do we lower the price knowing we have a fixed supply, but our demand's going to just keep going and going and going for a lot of different reasons? This is what chokes me up. This is where I get all upset sometimes, because the last thing I want to say is the government needs to step in, but I think the government does need to step in here. And that's where you have to really look at how do they do that. And I don't think Donald Trump is all that wrong when he says, let's take that subsidy money and give it back to the people that need it in HSA numbers or in HSA accounts or in something like that. I don't think he's right, but I don't think he's all that wrong. And here's what I mean by that. You just give government money to people, they're not going to spend it right. They're not going to use it the way you intend it to. So even if you put it in an HSA account for medical expenses, they're going to use it for different things, but it may not be exactly what you wanted them or intended them to use it for. However, where government can really help, and this is where I think the Republicans and Democrats can get around something is they need to actually create price fixing. Since we know that we have a limited supply of what can be provided on on the healthcare side, the only way we're going to reduce costs, or at least keep them from growing at a high rate of inflation, is if we put a reimbursement cap on it. And that does mean we do have to nationalize healthcare, which I'm actually against. But when I've looked at it from all different areas, from an economic perspective, this is the only way you could do it. And when I say nationalize healthcare, I don't mean where the government controls it, but where government controls the pricing. They control exactly what, they negotiate with the drug companies, they negotiate with all these different things, not just for Medicare and Medicaid, but all across the board. Because what they'll do is they will reimburse the insurance company. So you can still have your individual insurance companies to work individually, things like that. But now what you have is you have it more of a voucher system per se, and essentially where, let's just say, broken leg, broken leg, non-displaced, non-surgical. Let's just say total reimbursement cost is $20,000. So now it's actually on the consumer and the insurance company or the medical field. Hey, we know the most we're going to get is $20,000. None of these funky discounts and this and that and so on and so forth. Most of what we're going to get in there is $20,000. So to provide that care to that person, that's going to take 3, 6, 8 months, including physical therapy. And I mean, total recovery cost is $20,000. So that's cast, crutches, wheelchair, all those different things. Maybe it's $50,000 for surgery, all those different things. Whatever. We set what those prices are across the country. Now, the hospital or the doctor's office or whatever, so I'm just going to say an area in my area is direct orthopedic care. Maybe they can actually treat those non-displaced fractures for $8,000 from x-ray to back to work, back to play, whatever it might be, over 4 or 5 months, including physical therapy. That's going to actually now force the hospitals to do it at $8,000. That's going to force the independent orthopedists to do it at $10,000. And then now, hey, we're starting to lose some clients, and now we're going to do it at $9,000. And so you're going to start to see that drop. It will take time, but it also is going to be dependent on the consumer to call around, to be educated. Most of the consumers are not educated when it comes to medical. When they go into the ER, in fact, I had a conversation with someone the other day. When they go into the ER, they're in the ER. Yeah, you're not thinking about doing this, doing that, da da da. But I have another friend whose daughter broke her wrist. It wasn't a bad break, so all they were going to do was put it in a splint. And as a breaking up the splint, he asked her, "Well, how much is the splint?" And they're like, "Well, I don't know. Insurance covers it." He's like, "No. How much is the splint?" And they're like, "We don't know." So after an hour, now unfortunately his daughter is in pain. They need to put a splint on or whatever. After an hour, they're like, "Oh yeah, it's $600." He goes on Amazon and he goes on to Walgreens and CVS because she needs the splint. She needs it right away, so he can't wait 4 hours or even a day on Amazon. But he finds it at CVS right down the street, the same splint for $29.99. So he runs out, grabs it at CVS, comes back, puts the splint on. She's good. That's another way you actually reduce the healthcare costs because of all that in there. So if we can really look at teaming up with different partners, we can do different things where we can keep costs down. So we have to think about it differently. But if I was advising Republicans and Democrats, that's what I would start talking about on a healthcare perspective. It's not just giving it to them an HSA account, because I don't think people are going to make smart decisions completely with that. What I think that we need to do is we do need to put a price cap, price fix it, and then allow for competition of care. And that does mean I think the managed cares like Kaiser Permanente, Baylor Scott White in my area, Intermountain, I'm sure there's a few others, they're going to actually take more prominence because they're going to be able to get economies of scale. And so those are some of the different things. So that is Dr. Rodney's economic thoughts on healthcare. and what the government should do. If you like it, hit hit the like button and hit subscribe and pass this out. Have a great day.